When you start to feel a bit off, a sniffle, a cough, a sore throat, it can be tricky to know exactly what's going on inside your body. The most common culprits are respiratory illnesses, conditions that affect your breathing system, your nose, your throat, your lungs. These are often caused by tiny germs called viruses, bacteria. A common cold, for instance, is caused by one of over 200 different viruses. The flu, short for influenza, is also caused by a virus, but it's a different and often more powerful one. These germs are all around us, and they can spread easily from person to person. It's important to understand that while many of these illnesses feel similar at first, they are actually quite different. Understanding the basics of these common conditions empowers you to take control of your health and get back on your feet sooner. Let's take a closer look at these common health problems so you can become a bit of a detective about your own symptoms. The common cold is something almost everyone experiences. It usually starts slowly, maybe with a scratchy throat or a runny nose. Over a day or two, you might start sneezing more and your nose might feel blocked. You generally feel unwell, but you can often still carry on with your day, even if you feel a bit sluggish. The cold is a master of being just annoying enough to notice, but not severe enough to keep you completely in bed. The flu, or influenza, is a different story. It usually hits you suddenly and with much more force. One minute you might feel fine, and the next you could feel like you've been hit by a bus. The flu brings on a high temperature or fever, body aches, chills, and a headache. You'll likely feel extremely tired and weak, making it very difficult to get out of bed. To make things even clearer, let's compare the main symptoms side by side. Think of it as a checklist to help you figure out what might be bothering you. For a common cold, the symptoms tend to appear gradually. Stuffy nose, runny nose, sore throat, a lot of sneezing, a cough, usually mild to moderate. Fever is rare in adults. Children might get a slight one. The whole experience usually lasts about 7 to 10 days. Now, let's look at the flu. The biggest difference is how fast it comes on, very sudden. A fever is very common and often high between 38 and 40 degrees C. Muscle aches, joint pain, headaches, chills. You will feel extremely tired and weak, can last 2 to 3 weeks. A cough is common and can become severe. Allergies have a very different symptom profile. Sneezing, an itchy nose, itchy, watery eyes. You'll likely have a runny nose with clear, thin mucus. Crucially, allergies do not cause a fever or body aches. No matter what's causing you to feel under the weather, there are simple, comforting things you can do at home to help your body heal. The most important tip is to get plenty of rest. When you are sick, your body is fighting germs or dealing with inflammation. Pushing yourself to go to work or school will only make you feel worse and may prolong your illness. Staying hydrated is as important as resting. If you have a fever, a runny nose, or a lot of coughing, you lose fluids faster than usual. Drink water, clear broths, diluted fruit juices to replace fluids. This helps thin mucus in your nose and chest. Warm drinks soothe a sore throat. Have warm herbal tea, add a little honey or lemon to comfort your throat. Avoid drinks with caffeine or alcohol. They dehydrate. Over-the-counter medicines can help, but use them wisely. For aches, pains, and fever, consider paracetamol or ibuprofen. Always read labels and take the right dose. Decongestant sprays or tablets may clear a stuffy nose. Avoid sprays for more than a few days. They can rebound and worsen congestion. Try simple home remedies used for generations. Gargling warm salt water soothes a sore throat. Mix half a teaspoon of salt into a glass of warm water. Gargle for 30 seconds, then spit it out. For a stuffy nose, inhale steam. Lean over a bowl of hot water with a towel over your head. Or take a long, hot shower. One very useful device is a humidifier. A humidifier adds moisture to the air. Dry air can irritate your nasal passages. It can also irritate your throat. That makes symptoms like a stuffy nose and a dry cough feel much worse. By running a humidifier, especially in your bedroom while you sleep, you can help keep your airways moist. This can soothe your irritated throat. Antihistamines are a type of medicine that are particularly effective for allergies. As the name suggests, they work by blocking the effects of a chemical called histamine. Histamine causes itching. Histamine causes sneezing. Histamine causes a runny nose. You can get antihistamines as tablets. You can get antihistamines as nasal sprays. You can get antihistamines as eye drops. When it comes to the flu, our best defense is the annual flu vaccine. The vaccine works by introducing your immune system to a safe, inactive part of the flu virus. That lets your body build up protection without making you sick. The flu virus changes every year, which is why it's important to get a new vaccine each autumn. Of course, the best way to deal with a cold or the flu is to avoid getting it in the first place. Prevention is always better than cure. The single most effective thing you can do is to wash your hands frequently and thoroughly. Wash your hands with soap and warm water. Make a good lather and scrub for at least 20 seconds. Germs that cause colds and flu can live on surfaces like door handles, keyboards, phones. When you touch these surfaces and then touch your eyes, nose, mouth. Another key strategy is to try to avoid close contact with people who are already sick. If you are the one who is sick, cough or sneeze into a tissue and throw it away immediately. For those who suffer from allergies, avoiding your triggers is the main goal. If you have hay fever, check the daily pollen forecast. On high pollen days, consider spending less time outdoors, or keep your windows closed. If you're allergic to dust mites, use allergen-proof covers on pillows and mattresses. Regular vacuuming and dusting can also help reduce dust at home. Finally, looking after your general health supports your immune system. A strong immune system is better equipped to fight off germs. Support it by eating a healthy, balanced diet with plenty of fruits and vegetables. However, there are times when it's very important to seek medical advice. One key reason to call a doctor is if your symptoms are very severe. For example, a very high fever that doesn't come down with medicine, difficulty breathing or feeling short of breath, pain or pressure in your chest. Another important signal, symptoms not getting better or getting worse after a week or so. A typical cold should start to improve within 7 to 10 days. Be particularly careful with certain groups: very young children, older adults, especially over 65, people with asthma, heart disease, or diabetes. A doctor or pharmacist can reassure, diagnose, and ensure correct treatment. Follow these calm, simple guidelines to navigate cold and flu season safely and get well soon.